Hello, and welcome to this presentation of findings from my dissertation titled Measuring Livability and Its Influence on Health. I'm Nishita Dsouza, and thank you so much for joining me today. I'd like to begin with a brief land acknowledgement statement. Drexel University, where I'm completing my doctorate, is located on Lenni Lenape land. But in addition to just acknowledging this, I'd like to encourage the audience to go a little further to learn more about and honor the Lenni Lenape people. Suggestions include visiting their cultural center, paying a voluntary land tax, or my personal favorites, aligning your research with Indigenous data sovereignty, citing Indigenous science in your work, and committing to improving public health research practices for Indigenous populations. An overview of this presentation will go through a background and then the purpose and study aims of this dissertation. We'll dive in individually through Aim 1, which is a scoping review, Aim 2, which is measure creation, and Aim 3, examining associations between livability and health. We'll briefly touch on implications and future directions and acknowledgements. So diving right into the background of this dissertation, what is livability? What does livability mean to you? The definition that I prefer is that livability is the ability of a place and its systems to reliably meet basic human needs, provide opportunities for cultural or artistic expression, and foster a general sense of community. As you can see in Figure 1, these are core components of livability, which is usually what comes to mind when I ask people, what does livability mean to you? Things such as affordable and diverse housing, public transportation, local employment and education, access to local shops, etc. One of the most popular conceptualizations of livability, especially in scholarly literature, is Maslow's hierarchy of needs, which posits that there are basic or physiological needs that need to be addressed first, such as food, water, and shelter, followed by needs related to safety and security, or those fostering interpersonal connections, such as friendship, family, and intimacy. And at the top of the pyramid is what we commonly know as self-actualization, or the ability to lead a creative or fulfilling life. Maslow's hierarchy of needs has also been adapted to places, with viable places ones that meet basic or physiological needs, livable places as ones that foster safety, security, and those interpersonal connections, and memorable or lovable places as the ones that really enable you to live that creatively fulfilling life. Maslow's hierarchy of needs is extremely relatable across sectors. This is a quick shout out to the company my husband works at, Health Signals, which provides internet solutions for senior living facilities. They've redone Maslow's hierarchy of needs to posit that Wi-Fi is a basic need. While Maslow's hierarchy of needs is commonly known even in popular culture, what many don't know was that Maslow was not the original one to conceptualize this hierarchy of needs. Maslow spent 6 weeks living with the Blackfoot Nation in northwestern United States, where he found astounding levels of cooperation, minimal inequality, restorative justice, this concept of no poverty or everyone having full bellies because the community ensured that everyone was fed, high levels of life satisfaction, and wealth measured by generosity, not money or property, something that was different from the Western civilization as it was. Self-actualization conceptualized by the Blackfoot Nation was also innate and not something that was earned or evidenced by a good degree or a high-paying job. And there was a strong focus on community actualization, and that was the ultimate goal, not self-actualization. Maslow, in appropriating the hierarchy of needs, put an individual rights spin on it, essentially colonizing the understanding of livability that the Blackfoot Nation had, and put self-actualization at the top versus community actualization. This is really important because there is currently a divide in understandings of livability compared to how it's conceptualized by those for economic gain versus how residents or community residents actually understand the lived experience and the livability of their places. So, what is the purpose of this dissertation study? It's to investigate how livability is currently measured, to inform the creation of a novel measure of livability in the state of Connecticut, and to examine how livability and health are associated. So now that we've gone through why livability is important, let's answer the question, why measure livability? In the United States, there exist what are called geographies of inequality, as you can see on the map below. This is a map of Philadelphia, and as you can see in this neighborhood in North Philadelphia, the average life expectancy is 68 years. However, just 4 miles south, the average life expectancy in Center City is 88 years. As you can see, there's a big discrepancy in the average life expectancy. Geographies of inequality were created by racial residential segregation coupled with historical disinvestment, resulting in these unlivable environments defined by poor living and/or environmental conditions, less exposure to health promoting social or built environment features, and less opportunity for upward economic mobility or neighborhood choice. This results in greater exposure to social and environmental health hazards coupled with less access to quality health and/or social services, resulting in what we know as health disparities or higher rates of cardiovascular disease, diabetes, obesity, and other health disparities, including average life expectancy. As we've alluded to earlier when discussing Maslow's hierarchy of needs, current livability measurement is skewed and largely relies on economic indicators designed to attract new residents or tourists, potentially leading to gentrification of urban areas, and depicts certain geographic areas as more livable than others out of a sense of competition. Ideally, though, livability measurement would balance economic and social indicators, accurately representing the lived experiences of residents, setting a precedent for achieving equity by examining disparities within cities instead of masking them, and reframing the concept of livability for the creation and sustenance of life-affirming places. Scholars have demonstrated much success with connecting health agendas to livability to increase the policy relevance of public health research findings, improving the dissemination of evidence-based practices and community design to ultimately improve the health of populations. However, there are very few studies measuring livability in a U.S. residential context. Despite the wealth of information in public health sciences about how neighborhood level factors influence health, there's limited information about how livability and health are associated. Now we'll transition to discussing this dissertation study aims. There are 3 aims which we'll go into one by one. Aim 1 was a scoping review and aimed to review previous measures of livability and examine the validation process used to estimate measure strength. Aim 2 will involve creation of a new measure of livability, a composite livability measure, and to evaluate its measurement properties. And Aim 3, which is about livability and health, aims to examine associations between livability and health among Connecticut residents. So let's dive into Aim 1, which was a scoping review of existing livability measures. So for this scoping review, 3 databases were searched to identify the breadth of fields that are studying the construct of livability. The Ovid interface of PubMed, Google Scholar, and Web of Science. Searches involved a combination of the terms that you see to the right of this slide, such as livability or related terms like neighborhood quality of life, measure or measurement, and keywords related to measure strength, such as reliability and validity. Our scoping searches identified 24 studies in total, 15 from database searching and 9 additional studies from backward citation searches, which were looking through the citations of the 15 studies to see if there were anything that the searches missed. Over half of the studies were published in 2018 and 2019, prior to the onset of the COVID-19 pandemic. Two-thirds of the studies were published in the last 5 years, really pointing to this growing trend of studying livability. Most studies were done in an urban context, but some were done in a rural or semi-urban context. And the studies had truly global representation, with almost every continent reflected except for Antarctica, and one regional analysis of countries across Europe and 2 global analyses of global cities. This is a figure of how livability was conceptualized differently across studies. There were very few studies that conceptualized livability similarly, and they used a wide range of domains, ranging from a one domain measure of livability, which was one survey question, how livable is the place you live in, ranging to 11 domains representing public sectors that all in some way, shape, or form work collectively uh, to determine the quality of life in a certain area. Each domain listed in this table had indicators ranging from 1 to over 100 to represent that certain domain. This scoping review also assessed the extent to which studies established the reliability and validity of livability measures. Reliability is how consistent a measure is, or if that certain measurement can be replicated. We found that only half of the studies calculated reliability, and most reported a statistic called a Cronbach's alpha, which indicates the internal consistency of a measure. And most found that the Cronbach's alpha was greater than 0.7, a statistically accepted threshold to indicate that the measure is highly reliable. Validity is the accuracy of a measure, or whether or not it measures what it's supposed to. What we found in studies were that there are multiple types of validity used to describe livability measures, and each set of scholars had their own way of approaching how they validated their measures. Some scholars relied on face validity, which is if a measure appears reasonable and is deemed appropriate, while some just commented on the fact that their measure seemed face valid. Some used a higher form of face validity, such as expert review, where they convened a panel of experts and asked them, does this measure livability in your opinion? Less studies relied on another form of validity called convergent validity, which is a measure's ability to correlate with similar but conceptually differing constructs, usually done through regression models. Such constructs that were used to establish convergent validity were quality of life, availability of amenities, and sense of place. Some studies relied on the predictive ability, or the ability of the livability measure to predict a certain outcome. Outcomes examples including perceived health, subjective well-being, and population growth. And lastly, scholars also assessed divergent validity. Only 2 studies in the literature review did that, but it was a measure's ability to demonstrate something that it's not supposed to measure. This is in the case of objective and subjective indicators of livability, which we'll touch on in the next slide. One last quick point about face validity. While every study in the review commented on face validity, not all of them relied solely on face validity to establish the validity of their measure. So, what are objective versus subjective indicators of livability? Objective indicators are those that are quantifiable or quote unquote impartial by nature. They tend to be more statistical and collected from administrative data, such as percent of income devoted to monthly housing costs or number of jobs accessible within a 45-minute transit commute. Also, spatial data tends to be objective in nature. However, subjective indicators are those that represent perceptions or intangible qualities of areas, such as trust or collective efficacy, usually measured through survey questions. What this scoping review found was that some scholars established the divergent validity of objective and subjective indicators, showing that objective indicators alone are not sufficient to capture perceptions of livability, and demonstrating the true necessity of subjective indicators and this need to better understand the lived experiences of residents by asking them their perceptions and these intangible qualities of the places they live in. So those were findings from AIM 1, the scoping review. We used findings from that review to inform our approach for AIM 2, which was the creation of a novel measure of livability. To complete this aim, we partnered with Data Haven, a civic engagement organization located in Connecticut, who operates the Data Haven Community Wellbeing Survey, a phone-based household survey with statewide representative data about quality of life, neighborhood perceptions, and health and well-being. We aggregated the different livability survey items in the measure and conducted a confirmatory factor analysis to examine if these survey items cluster into one factor, which would be livability. We also conducted an exploratory factor analysis to identify how these survey items actually clustered once we found that the one factor model was not sufficient. I'll get into that. We also, once we had an idea of how our livability measure would be created, we ran linear regression models to establish the convergent validity of livability measures with other objective measures such as opportunity and deprivation, and also with subjective measures that were included in the Data Haven Community Wellbeing Survey, such as place satisfaction. Our factor analysis found that a one-factor model was not a good statistical solution and explained only 37.8% of the variance in livability-related survey items, which is lower than the statistically accepted threshold. When we ran a confirmatory model, we found that these survey items clustered best into a three-factor model, which explained 69.4% of the variance. These three factors, the first of which is safety. This one factor, safety, explained 21.9% of the variance and included 9 survey items, including such as gang membership potential, potential of youth to be arrested for a felony, and potential of neighborhood organizing. The second factor was opportunity, which explained 18.0% of the variance, and included 9 items, including such as the availability of goods and services, the ability to obtain suitable employment, and the presence of public parks and recreation. And the last factor was what we dubbed infrastructure, which explained 9% of the variance and included only 4 items, things such as stores in walking distance, safe sidewalks, or places to bike, safe from traffic. After careful consideration of the factor analysis results, we decided to proceed with creating an overall measure just to see what a holistic approach to livability measurement would look like, and because a holistic measure is parsimonious and more easy to explain and connect across sectors. However, we decided to proceed with the 3-factor model as well and to create these 3 subscales, safety, opportunity, and infrastructure, because they illustrate nuances that are missed in the overall measure. The most notable being infrastructure. The pattern of townships in Connecticut that ranked highly on infrastructure, as you can see, weaves through the middle of the state, reflecting Connecticut's rich history of transit-oriented development. We calculated both the individual level and the township level reliabilities of these livability measures. Now, a reminder that reliability is the consistency of a measure, and higher scores, higher Cronbach's alpha scores, indicate better reliability. The overall measure had a very high individual level reliability, and also while the township level reliabilities appear lower for all measures, that is common in the literature. Um, Apologies, the township level reliability for infrastructure is 0.57. Apologies that my face is covering that statistic. But as you can see, there's a good range of reliability scores, and they indicate that the measures that we developed are strong. We also established the convergent validity of these livability measures through linear regression models. We found that higher rates of food and housing insecurity, place satisfaction, and opportunity were correlated with higher averages of overall livability, safety, and opportunity. We also found that higher rates of more negative outcomes such as deprivation, racial residential segregation, and the percentage of the population living in poverty were correlated with lower averages of overall livability, safety, and opportunity. As you notice on this slide, infrastructure is not there. That's because our findings for the infrastructure measure were a little different. The unadjusted models actually show findings in the opposite direction, but adjusted models showed no statistical significance. We attribute this to the complexity of infrastructure in more urban core areas where there is more infrastructure, but there are also greater social issues. And because of our data limitation of measuring these characteristics, livability, safety, etc., at the township level, we missed some nuances that occurred in livability changes from neighborhood to neighborhood in these townships instead. There is much more density and much more changes in perceived livability, even as you move street to street in some towns in Connecticut. So now that we've summarized findings from AIM 2, the measure creation of livability, we'll now move to AIM 3, which is examining associations between livability and health. For this aim, we fit generalized linear mixed models or multi-level models to assess the relationship between livability, a construct that is at the township level, and health outcomes, which are at the individual level. So livability and health are our focal relationship, but we also adjusted these models for individual level characteristics such as age, race and ethnicity, and income, and township level characteristics such as racial residential segregation and urban typology, which had 5 categories: wealthy, suburban, urban core, urban periphery, and rural. We fit models for each each of the livability measures we created, the 4 measures we created, and we also had 4 health outcomes of interest: self-rated health, BMI, which represents obesity, cardiovascular disease, and diabetes, resulting in 16 multi-level models in total. What we found from this aim was that increases in overall livability, safety, and opportunity resulted in higher odds of reporting excellent self-rated health, and increases in overall livability, safety, and opportunity resulted in reporting lower odds of cardiovascular disease. Adjusted models did not find any statistically significant associations between any of the livability measures and BMI outcomes. Infrastructure measure was also not statistically significantly associated with any of the health outcomes. The findings from AIM 3 do illustrate that there is some evidence associating livability and health outcomes, and point to the need for further studying livability in public health research. Some implications and future directions for this research are as follows. Standardizing livability measurement in not only public health sciences, but across fields and disciplines can facilitate communication and knowledge sharing, especially not only across fields and disciplines, but across geographies as well. Um, there's also much potential to explore using normative indicators to set visions for livability, especially as they relate to sustainability and we move forward with addressing the climate crisis. Another future direction for livability measurement would be eliminating the economic bias of existing livability measurement, pushing for stronger subjective measures to represent some of those more social, subjective, intangible qualities of places. And also limiting the competitive nature with which livability measurement is currently used. Another future direction is exploring new and novel data collection methods, such as ecological momentary assessments and new statistical approaches to better capture livability measurement data analysis, such as Bayesian analysis, which can help share strength across geography. Lastly, a future direction for livability measurement is the creation of a transdisciplinary research agenda for livability. So not a research agenda that is limited to sector specific and sort of siloed by discipline, but one really that multiple disciplines can come together to really advance livability research, not livability research in public health versus livability research in sociology, etc. There are a few acknowledgments I'd like to touch on for my dissertation. I'd like to thank my dissertation committee, especially my chair, Dr. Ana Martinez Donate. Thank you so much for your advice and mentorship over the past couple of years. Dr. Amy Carroll Scott, Dr. Harrison Quick, Dr. Irene Hedden, Dr. Rodrigo Reis, and Dr. Usama Bilal for all advising me in different capacities throughout the process of the dissertation. I'd like to thank Mark Abraham at Data Haven for being the most amazing community partner and being very generous with the data and his insights. My peers and colleagues at Drexel University, thank you for giving me life. I'd also like to thank the ASE Livability Academy team for helping me bring this concept of livability alive, not just something that I studied on paper, but really implemented in a very grassroots way. It's a great group of people and we come together to really talk about improving quality of life. And lastly, my family and friends, thank you so much for all of your support. I'd also like to acknowledge that this dissertation is dedicated to all those who strive for a better life, especially my grandmother, Jane Fernandez, who passed away a few days after the COVID-19 pandemic was declared. She's my role model, and her legacy of persistence, hard work, and prayer really led me to greater opportunities and freedoms. And for that, I cannot thank her enough. Thank you all so much for watching this dissertation final defense recording. For a copy of the slides or for any questions related to livability, which is a personal passion of mine, feel free to email me at dsouza.nishi@gmail.com. That is my personal email and one of the best ways to reach me. You can also find me on LinkedIn and Twitter. Thank you. Thank you again for your interest and attention to this topic.